I am Dr. Kimon Slaughter. I am the facial plastics and hair restoration specialist at the Williams Center. Today I'm going to be talking to you about the evolution of hair transplant surgery. And that really is going to be more comprehensive than just the transplant surgery part of it. I'm going to talk about just daily maintenance of your hair and scalp that will hopefully help improve your density, help you grow more hair if you're having thinning. I also talk about non-surgical options, and then with the original PowerPoint, I was going to show you pictures, but these pictures are also available online and on my Instagram accounts, which one is KSlaughterMD, and the other handle is at The Real Hair Doc New York. So all of these pictures are pretty redundant if you wanted to check them out. So I'll get right into it. I'll try to get through it quickly, really to allow everyone time to answer or ask any questions that they may have, whether specifically related to themselves or just in general. So in the evolution of hair transplant surgery, most people have heard of hair plugs and hair grafts, and that's usually what most people will ask me. Hey, so you do hair plugs, right? And I say, well, actually, we don't quite do that anymore. It's a little bit more refined, but from a historical standpoint, hair surgery really began in the late 1930s. Actually, the roots began in Japan. So there was a physician named Dr. Okuda, who was a Japanese dermatologist in 1939. He actually was one of the first to document hair transplant with punch grafts and burn victims in Japan. So he would get patients that were scarred up from burns and just take plugs of hair from wherever they had it and just kind of transplant them in those big plugs. And that was kind of the origin of what will evolve into modern day hair restoration surgery. Dr. Tamura in 1943, who was another Japanese physician, actually took that Dr. Okuda's technique and refined it a little bit more. So instead of these big, large plugs, he was focused on doing pubic hair transplants, interesting enough. And so you can't have big plugs for most pubic transplants. So he actually cut the grafts down and found that they survived pretty well. So that was Dr. Tamura, who refined that technique. It wasn't until 1952, actually, that a doctor in New York City, Dr. Norman Arentrick, performed the first hair transplant on a male for male pattern balding. That was done in New York City, and that kind of set the stage, at least in the United States, to put hair transplant firmly on the map. In about the 1960 time point, hair transplant surgery was kind of firmly established in cosmetic surgery in the US. So 1990s, we see hair transplant surgery becomes more refined. So the terminology of plugs and all of those big grafts were kind of left behind. And in the 90s, we start looking at refined FUE transplantation, follicular micrografting, and all of the techniques that we use now that are very natural. And that's kind of how things have evolved. So specifically, if you look at hair loss and an overview from comparing men to women, most hair loss in men and women actually is related to just basic male pattern or female pattern balding. For men, you might have heard the terminology androgenetic alopecia, which actually for most men, that's 95% of hair loss, which is related to the effects of testosterone being converted to dihydrotestosterone, which causes sensitivity to natural hair or hair follicles, and over time those hairs actually disappear. So that's the link to that. For women, there's a misnomer you might have heard or even been diagnosed yourself with female pattern baldness, which is androgenetic alopecia, which is actually a misnomer. In most women, the androgen levels are completely normal. So if you do test, you'll find that women have completely normal testosterone and androgen levels. And so to call it androgenetic is actually a bit of a misnomer. But either way, it's still 50% of what you see in most women, the female pattern balding pattern. Does not necessarily correlate with androgens like I mentioned before. So there are many other types of hair conditions, and I encourage you, if you, I got people from all over the world, make sure you have a thorough workup if you're concerned about, a particular condition. Certainly thyroid conditions, autoimmune conditions. There are infectious etiologies in the Northeast. Lyme disease is a pretty big player. There's the concept of telogen effluvium, which is a stress response to hair. So basically, if you've had a loss in the family or you're undergoing a, stressful, divorce or relationship, those sorts of things can cause the temporary shedding of hair. If it's a true effluvium related to stress, then you would expect to see that hair return in about 3 to 4 months. That's kind of the definition. It has to come back. There are also cicatricial alopecias, which are usually ethnic related phenomenon. So certain populations, African Americans, certain Indian groups that wear their hair in certain dreadlocks or braids, that can cause a lot of stress on hair, and that over time can cause you to get thinning or just complete loss. There's also a condition called alopecia areata and other conditions like lichen planopilaris. These are full spectrum autoimmune diseases that people frequently get the diagnosis of, and these are certainly things that you want to rule out before you go down the pathway of surgical transplantation or some of the other options. People also ask me frequently about chemical processing. So women, doc, could this thinning be from me having gotten permed or my hair dyed for many years? And the thought is that if you do things within, reason, you get your hair colored every few weeks or month or something like that, then it's usually not thought to cause hair loss. But certainly chemical overprocessing, so heavy dye and lye relaxers over time can certainly cause some trauma to the hair and end up with thinning and shedding. So if you experience this, then you really want to have someone do a diagnostic workup. I typically refer patients to dermatologists or internal medicine doctors. They usually can draw the labs such as CBCs to look for any iron deficiencies, or chemistry panels if you have electrolyte abnormalities. Certainly thyroid function testing is very important. You want to make sure your thyroid levels are pretty stable. Androgen levels, like we mentioned, especially if you're a woman and you're experiencing masculinizing symptoms. You have an excess facial hair growth or deepening of the voice or certain conditions such as polycystic ovaries. You want to check those conditions out first. And then the ultimate diagnostic technique or method is actually a biopsy. So that will give you a lot of information. If you have patchy spots or doctors can't figure out what the nature of your loss and thinning is, and the biopsy becomes the ultimate test to kind of give you the information for what you need. So other than that, I always talk about a natural and routine regimen for hair care. So you need quality shampoos and conditioners. Hair vitamins and supplements are very important. Typically iron, zinc, biotin, keratin, L-cysteine are kind of the key building blocks for building a strong, healthy hair. Certain shampoos and conditioners can be very important. There are only two shampoos that have been shown to show a pro-growth effect, and that is ketoconazole, which is Nizoral. That's an antifungal shampoo. The other one is pyrithione zinc, which is commonly found in Head and Shoulders. So those are the two ingredients that could possibly help create denser, stronger hair for you. Now, if you are, you've been using a product and it's a high quality shampoo and conditioner, you've been using it for many years, then I do not recommend that you stop that as long as you're not experiencing any sensitivity in the scalp or having any issues. If you've been using a product for a long time, continue to use that product. I wouldn't encourage that you switch to something just because it could possibly maybe help grow a little bit more hair. Typically, when you do that, you'll change the pH balance and makeup of your hair, and you'll start having even more issues or dry scalp and that sort of thing. So if you've been using a product for a while, continue to use that product. There are also other things that people do: hair serums, steroids, DHT blocking shampoos. Those things I find are not usually as effective, but certainly, like I said, if they're not causing irritation, I don't think they're going to hurt you to use these products. I had a patient that showed me a DHT blocking shampoo. She was female, and I told her that that probably was not going to be effective because if you remember, DHT is the byproduct of testosterone. So if you don't have testosterone that's causing your hair loss with the conversion, in a DHT shampoo is not going to help you as a female. It could potentially be helpful as a male. I would say as long as you're not, spending a ton of money on it, then, I think that's something reasonable to try. The general rule, however, and a lot of people end up over shampooing and under conditioning. So I would say if that is the case for you, you actually want to under shampoo and over condition. So once to twice a week of shampooing is about all you need. Anything more than that, you're typically stripping your scalp of healthy oils, healthy keratin, that sort of thing. And a lot of people say, well, doc, I work out a lot, I have a sweaty scalp, I have to wash my hair, so what do I do? If that's the case, then I encourage people to try different shampoo or conditioners. So try different conditioners. Instead of shampooing your hair, use a conditioner, to see if that can help condition the hair and kind of clean the hair without stripping it of the good stuff. So that's my recommendation for that. There are non-prescription medications. They're very limited for hair loss and thinning. And most of you have probably heard of Rogaine. That's over the counter. Used to be a 3% women's, 5% men's. Now it's just 5% in a foam or solution. That tends to be somewhat effective. You have to be pretty consistent with it. The side effects are irritation. If you get it on your, on the face at night from it rolling, rubbing down, then you can actually get some stimulation of facial hair growth, which might be an issue for some women. But otherwise, I think it's a decent option to try. I recommend it for all of my young hair loss patients to try the Rogaine. Just remember, you got to be very consistent with it. If you miss a date, or say if you're doing this treatment for several months to years and you stop it, do know that you will potentially lose what you've gained from it. So if you commit to these treatment options, especially Rogaine, then know you have to kind of be committed to it for a bit. And some people say, well, how long am I expected to take this? Do I take it for forever? Well, in theory, whatever process is causing your hair thinning and loss will beat out whatever. So you might find that even taking the minoxidil for many years, after a while, it just doesn't work anymore. And at that point, it's probably run its course, and then you want to, get reevaluated and reassess if there are other options that may be effective for you. And then there's also prescription medications. They're basically the same class of medications we've been using for many years. For men, there's dutasteride and finasteride. Those are the anti-androgen blocking medications that I typically prescribe only for men. They are the gold standard. They are very effective. Most men get a little bit reluctant because there's some link with potential sexual side effects, which we're slowly finding is being less and less of a factor. So really used to be 3 to 5% of men might experience some sort of sexual issue, and we're learning that that's probably not quite the case, that these are probably men that were going to experience those issues anyway without the effects of the medication. But they are still great medications to use, especially if you're, a younger hair loss patient. I'm going to definitely recommend that, as part of your treatment option. There's also now oral minoxidil, which is kind of a new player. Rogaine's active ingredient is minoxidil. That's the topical foam or solution. The oral version is actually much more potent, and I highly recommend you considering that as well. The side effects for men, not as big of a deal. For women, it's not specific to scalp hair, so it can stimulate a pretty decent amount of facial hair growth if you grow facial hair. It's not going to turn peach fuzz or villous fine hair into strong hair, but certainly it's something to consider. Now, also, that medication will cause the early shedding. It recovers, but just I always tell patients, when you start taking this medication, just be aware the first couple of weeks you might experience some shedding, and that typically recovers over a few months. So those are the two really most commonly used medications. There's also a third, which is typically for females. It's called spironolactone. It's a diuretic. It's another blood pressure medication. To be honest with you, I have not been impressed with the effectiveness of it, and I actually do not prescribe it. So if that's something you want to consider, then I would point you to a dermatologist or a family medicine doctor who is well versed in hair. I just don't feel like it's as beneficial, and you have to monitor your labs because it is a diuretic. So you're checking magnesium, potassium every so many weeks to months, and I feel like the results that I see versus the work you have to do to just be able to take it are not really worth it to me. So that's not a medication that I typically recommend. I just include it to be comprehensive. There's also things you might have heard of like low-level laser therapy or laser light caps, and that's sometimes a pretty faddish thing. You see baseball caps, combs, domes, and all these kind of things that emit this light treatment. And the thought is that it stimulates, enhances cell function, vascularity, and that sort of thing. I will tell you also that I'm very skeptical of these treatments as well. if you're independently wealthy and you can spend any kind of money, then certainly try it out. I don't think it's going to hurt you as far as we know, but I just don't think it's the most effective. And these products can cost, upwards of a couple $1,000s for a good helmet. And I'm just not impressed again with the results. So I put that in the category of things that, hey, if you want to try everything, certainly. If you're looking for the best bang for your buck or the most effective, then these might disappoint you a little bit. And then there are other miscellaneous treatments that I have patients that talk about. So steroid injections, which, if you have certain conditions, certain autoimmune conditions, I think that these are some that you can consider. A steroid injection for an autoimmune areata can be helpful. Scalp massage, there's acupuncture techniques and essential oils that people rub on their scalp and do scalp massage, and these can be beneficial. I will tell you, if you are an essential oils person, some of the oils can be pretty strong and they can burn, so just be careful if you're going to try a thyme oil or a tea tree oil, that you're just aware if you have any irritated spots, you might want to avoid those because they can really cause some discomfort. So that's the non-surgical side, with the exception of a treatment called PRP, or platelet-rich plasma, which is kind of a hot topic. PRP is what I consider the body's natural way to stimulate hair. The misconception is that everybody's a candidate, and I see people on the internet and all over Instagram and social media promoting use of PRP and that it grows hair, but really it's a very specific population of patients that I think benefit from it. Female patients who have pretty diffuse thinning that might not be transplant candidates are certainly usually good candidates for PRP. Patients that have certain scalp conditions that might be steroid responsive, but they don't want to take medications, they can consider PRP. Boosting hair transplant grafts is another indication. So the concept is you have platelets in your bloodstream, we draw your blood, we spin it down with a special process, and I actually inject this PRP and microneedle it into the scalp. And it stimulates hair growth, makes weaker hair stronger, so ultimately you have a healthier scalp and a thicker head of hair. But like I said, don't buy into the hype that PRP is for everyone. It really, the candidacy of your particular hair loss situation needs to be assessed. And I will tell you, I probably turn down more people than I think are candidates for it. And usually other practices are the opposite. They're going to take everybody and then say, oh, well, it just didn't work for you. Well, it was never going to work for you because you weren't a candidate. So just be very careful if you are very interested in PRP, that you do your homework, your research on the people that you might go get the treatment from. All right, so the one thing about PRP I'll mention is that it can be an all-natural option. And the way I do it is specifically for people who don't want to take medications, who don't want chemicals and things and topical stuff that's not really natural on their scalp or for their hair. So the way I do it is just basically your blood is spun down. The only foreign agent is the numbing medication that I use so that you don't feel the needles, and the process is fairly comfortable. Other people activate it with calcium and ATP and other things that make it a less natural option. So keep that in mind too. If you're looking for something that is a natural alternative, you don't want to take pills, and just make sure you know that persons who's going to be treating you know what they're putting in their PRP, because it is not all the same. All right, and that puts us into the last stretch, which is surgical hair restoration. If you are deemed to be a candidate for surgical hair restoration, and there are two options for it, and we talked about in the evolution of hair where it used to be the gaudy plugs, it wasn't very natural looking, hairlines were very, Donald Trumpish and all this kind of stuff. And sorry if you're a Trump supporter, but anyway, now the evolution is where you have very natural groupings of hair. So the way it comes out of the scalp is the way we transplant it in a very natural effect. There are two techniques of harvesting hair. So there's classically the strip, which is still considered by many people to be the best option. You take a strip of hair in the back. As long as you have your hair at a 1/2 inch or longer, you'll never see that scar. It's just really not an issue. And I actually have pictures that I can show you of that if you are interested. And that hair is under a microscope specifically dissected out into perfect grafts. We have a phenomenal team here of expertise. Some of the techs have been here for a couple of decades, so you can't find that in too many places around the country. And those hairs are expertly cut up and transplanted under my guidance and direction. And so that's one technique. The other technique, which is a hot topic now, is called FUE, or follicular unit extraction. And the reason why it's a hot topic is because there's a lot of technology like the NeoGraft you may have heard of, or the autograft or SmartGraft, and the Artist robot, which has everybody interested in now hair restoration. The problem with FUE is that the graft quality suffers quite a bit, and really for projects that are large volume hair transplants, you really want to consider the strip. Now, the advantages of the FUE are that if you wear your hair very short, a lot of my patients are military background, or certain ethnic populations, they wear their hair really, really short, where you're definitely going to see a linear scar, then FUE may be one of the only options that you have. And certainly for very specific projects, it can be very effective. And we do both techniques here. And so what I would say is, you come in for a consult and we can talk about which one works for you. I will tell you that the gold standard typically still sits around the strip method. So we use a very light sedation. It's basically an in-office procedure, a little bit of local, pretty relaxed day. Hair transplant does take a little bit of time because we're very meticulous about our design. We're very meticulous about cutting perfect grafts and transplanting everything. But overall, we're super efficient and you get through it pretty fine. There's no issues with it. So some people ask me about other types of transplantation. There are specialty transplants, beard transplants. I've done goatee, mustache transplants. We do a fair bit of brow transplants. We've had a few consults for pubic hair transplants, go figure. And so there are certainly other indications for hair restoration, covering scars, traumatic, surgery from other procedures, facelifts, brow lifts. You can sometimes see those scars. We do a lot of transgender work, so feminizing the hairline, lowering the hairline. I mean, the options are really limitless now that we have the techniques to transplant hairs exactly how your body grew them. So that's a good thing. And then a lot of people ask me about future technology. So hair cloning is something that was a hot topic. We found out that the first hair cloning project, it seemed like it went very well. The problem is the hairs did not go through a second cycle. So I think that's kind of on hold right now. And there's some other research about vaccines for hair that you would get when you're really young, and it will prevent you from losing hair, if you were genetically predisposed to it. So that's basically the kind of the meat of the presentation. I was gonna, like I said, show pictures, and I apologize that the PowerPoints aren't loading up. Like I said, a lot of my pictures are on the internet, on social media, and I would love, if you had a chance to call me and we can set up a consult to discuss your particular problem. So what I will do now is open up the forum for questions, and please don't be shy. Let me see here. Let me unmute you guys. And you can also type in type in questions as well. So I'll open up that if you're a little bit shy to speak over the internet. Okay. Do I hear anything? There we go. All right. All right, so it looks like I have a question about cost. Right there. All right, so that's a great question. So hair transplant, specifically, we price based off of graft pricing. So usually you can find across the country graft prices ranging from anywhere from $5 to up to $7 a graft. One of the things that controls pricing with hair restoration is the team and the facility where you have it done. A lot of practices, they're not full-time hair practices. So therefore, they kind of bring in techs and bring in their team to get the case done on the very few instances that they have the opportunity to do it. So that bumps up the price a little bit. Here at Saratoga, we are a full-time hair practice. So our team is all in-house. We don't bring in any extra people. And so it keeps the pricing pretty fair. So I'll tell you, the average transplant ranges probably between the $5,000 to $10,000 range. And I'll say the good thing about hair transplant surgery is that we can do it in projects. We can fit your budget. If you say, you know what, well, I don't have $10,000, but maybe I can afford $5,000, then we can design a project that kind of fits your budget, and we can build on it. So then you can say, I'll do this, and maybe in a few more years we can work on another area. So that's also a good option, and it always looks pretty natural. It doesn't look incomplete. You're not going to say, hey, well, when are you going to finish the rest of the transplant? It'll look very natural. So PRP pricing tends to be about $3,500 for a package. We put that together because one of the things with PRP is that you need multiple treatments. So my package is a package of 4. Every 6 to 8 weeks, I recommend the treatment. And then after you finish the package of 4, it's once to twice a year maintenance. So that's the pricing for that. And I see another addition to that question, the range price for strip transplant. Strip transplant is actually a little bit cheaper. So FUE grafts tend to be at about $7 to $7.50 a graft. Specialty transplants can be $8 to $8.50 a graft. Strip surgery tends to run, like I said, $5 or $6, $6-7 a graft, depending on how many grafts you get. I would say, for example, a 1,000 graft session, which is a smaller session, is probably going to be in the $5,000 range. Now, we always run specials. I always run some sort of winter special, summer special, track season is in, some kind of special is going to be happening. So if you're interested, you can always call and say, hey, what kind of specials are you running right now? Our current specials are for anything over 1,800 grafts, you get $1,000 off, which is that's a big hit to the price, and certainly it's encouraged more people to consider hair transplant surgery. All right, so I got another one. So, hi doc, Septoprant antagonist of prostaglandin or PGD2, RU58841, no steroidal anti-androgen. Are you basically asking me kind of what I think about it, or if it's effective? Is that the question? Or is the question is it an antagonist of the prostaglandin system? Septoprant, I believe, is actually an antagonist of the system. Prostaglandins, now we're talking kind of on the PRP side, really, because a lot of the growth factors, PG2, VEG2, a lot of the things that are stimulating TNFs that are blocking those things that can damage hair are related to the PRP. So if you're looking for that sort of treatment, now you're flipping to the PRP side, and those things can help, balance growing hair in that setting. So I don't really prescribe those types of medications, and I'll tell you, to be honest with you, be skeptical if somebody is promising you a big result based off of that. These are very expensive medications, and so certainly I can talk you through it. We can do research together. If I don't know about it, I'll find somebody that does, and we can figure out if it's an option for you. All right, let's see. Hopefully I answered that question. If not, keep throwing them at me. Let's see here. All right, surgery takes about, depending, the larger transplants take about 5-6 hours. If you're talking about a brow transplant, that's something that you can do in a few hours. If you're talking about FUE cases, they tend to take a little bit longer, because those are harvested individually by me and my most experienced tech. So we're very careful and very meticulous and super, super fussy, so we don't rush it. So you can expect to be here for quite a while. But listen, Saratoga is beautiful. We serve you a great lunch. You'll be relaxed. We got a great team to talk to, and we like to laugh and joke around, so you'll have a good time. All right. So, well, I appreciate that. That is, I got a compliment, but I'm not going to read it, but I appreciate that. Okay, how about an alkaline diet? That's a good question too. There is a lot of literature on if the pH balance of your scalp can affect the growth of hair or the loss of hair. And there's certainly, you see all these commercials where, the shampoo or the product is pH balanced for XYZ. So there is a lot of literature on, well, if my diet or, kind of focusing on the fluctuations of alkalinity or acidity within the scalp, can that help? I actually do think that it can be a benefit. I don't know if we can tease it out specifically, meaning that if you can, translating an alkaline diet into your blood and the blood and serum around your hair follicles being alkaline, I'm not sure if that's quite the case, but I do think that overall it's a more healthy thing to do, and it can certainly benefit it. A lot of topical agents are aimed at trying to balance pH, and the thought is that you tend to have better hair growth with an alkaline scalp than you do with an acidic scalp. But I don't know if you're eating a diet that is mostly alkaline. If it really does translate that specifically in theory, absolutely. So I would say if it's not a big hassle for you to try alkaline foods, alkaline waters and certain vegetables can alkalinize the blood, then I would give it a shot for sure. Anything that can help. I definitely don't think it will hurt. I haven't heard about it hurting. So give it a shot for sure. These are good questions. I like these questions. It's challenging me. All right. All right. Well, listen, I appreciate you guys tuning in and being patient with me. I've done a few of these webinars. This one I wanted to do a more comprehensive one to just kind of put it all out there and to stimulate thoughts. I will be focusing on more specific topics as we get along the year. Maybe looking at specifically teasing out FUE and why I say it might not be the best option. Specifically looking at PRP and the growth factors and things, and break it down at a more scientific level. So those are. Oh, got another question. Suppose reduce inflammation. Is this a potential approach? Absolutely. So the question is the Septoprant, which is a non-steroidal, reduces inflammation. Now, a lot of the conditions that we talked about at the very beginning, the autoimmune, the areatas, are also linked to increased inflammatory response in your scalp. So if you think about it, the body's always inflamed and not healing well, then you're not going to grow good hair. So certainly the reduction in inflammation can be a great approach. The one problem about some of those medications is that they can actually be damaging to other parts of the body. So particularly the stomach lining can really be affected by some of the PDGE2 blockers. You think about like the NSAIDs like Motrin and aspirin and those sorts of things. You don't want to take those excessively because they can destroy other tissues. They can work great at reducing inflammation in kind of a limited period, but you don't want to be excessive in those medications. So, it's a give and a take. Do I think if you have an irritated scalp or you have certain types of eczema or psoriasis or certain inflammatory spots, can it help? Absolutely. Do you want to be on it for the lifetime? No. So you got to kind of figure out what the source of the issue is and address that and use those medications sparingly to kind of help you get over the hurdle, if that makes sense. But yes, reducing inflammation is a great, and that's actually a very kind of generally healthy thing to do for the body. You talk about people are in the aloes now and all of the organic juices and that sort of thing, and all of that process is to reduce the body's inflammatory response. We know that if you are less inflamed throughout, then tissue recovers better, your body heals better, and you just are more healthier. So it certainly affects the hair. Is transplanted hair more androgen resistant? Let me think about that. Androgen resistant, absolutely. Because it in of itself is androgen resistant. That's why you typically will see even the baldest guy will have that kind of wreath of hair, right? Like you typically have never seen a guy that's all the way bald around unless they just shave it off. But usually they're kind of like, like, I don't want to say a clown, but kind of like this here and then the wreath of hair. That hair is genetically programmed to kind of not be affected by conversions of androgens in the DHT sort of process. So when you transplant it, it turns out it grows extremely well. So that's the whole premise of hair transplant surgery, is that we take that hair that's pretty resistant and wherever we put it, brows, beard, mustache, pubic hair, wherever you want it, that hair is not gonna go anywhere, and you'll actually keep it for the lifetime. So that leads to another question: is hair transplantation permanent? Because of that, we tend to think of it being the only option for permanent hair solutions. So if you're thinking about the best way to spend your dollars, then hair transplant surgery is the best way to go, because those grafts will outlive you. What is the most important consideration for patients considering a hair transplant? That's a good question. So candidacy for hair transplant is generally pretty straightforward. If you're otherwise pretty healthy, you don't have any significant conditions that we talked about that might make you want to consider not doing transplant. So some of those scarring conditions where we know we transplant your hair, then it might not grow as well from scarring. I'll tell you that age is not a factor. I've transplanted people that were, almost 100 years old. It's an in-office procedure that is basically skin surgery. So it's not like, a lot of the other surgeries I do where I'm, big facelifts and reconstructive stuff. It's not that. We don't put you to sleep where where you need a breathing tube. So I would say the most important consideration is your expectations for, what you want your hair to look like, and then time and cost, really. I will say that most guys and girls that after they have their transplant will say, man, I wish I would have done this sooner. So that's usually the first thing that people say is, man, this was such an easy process. And then once they see the hair grow, then they believe it. Then they're like, oh man, this is, now I want more. We got to transplant everything. So I think that transplant surgery is pretty easy. There are very few things that would prevent you from getting it and having a great result. So should I take vasodilating supplements? It's a good question too. The thought process behind the minoxidil that I mentioned, so oral minoxidil, is that it is a blood pressure medication that causes some vasodilation. And that translates into, if you think about blood vessels being kind of pipes, the bigger the pipes are, they deliver more nutrients and more good stuff to the scalp and to the hair. So in theory, you get more density and more growth. So vasodilating supplements, as long as they don't affect your hemodynamic system, meaning as long as you're not taking them to a point where you're so vasodilated that you're passing out, or you feel lightheaded or dizzy, then I think it's certainly a good option as well. So as long as you tolerate it, your blood pressure tolerates it, then they certainly can deliver some good nutrients to your scalp. All right, I'm just going through the questions. You guys are getting it going. I love it. All right, what's that one? Is that it? What's that one? I did that already? All right. All right, guys. Well, listen, I appreciate you tuning in to chat with me and listen to what I have to say. I really would love to have a one-on-one with all of you guys. If you're interested, like I said, the consults are free. We can do it whichever way makes it convenient for you, whether it's a FaceTime, face-to-face if you're in the Saratoga area. I do have a few consult offices in Latham. We have one in Newburgh if you're in the New York City area that I'd be happy to see you in. We can do, a lot of patients are older. They're not really cool with the computer stuff. So you can send pictures, email pictures, text pictures, and we can, after I review them, we can set up a phone conversation and just talk candidly about everything. But however we can get it done for you, I'd be happy to help you out. So thank you for tuning in. Dr. Slaughter again, and we're with Saratoga Hair, and hopefully we hear from you soon. All right, have a good evening.